session will be up to 11 a.m. Egypt time. Today with us are our panelists, Dr. Karan Singh Sagar, Gavi, Vikas Gaba from KPMG, and Laura from AppTech Uganda. Welcome you all. First of all, I'd request Mr. Joshua Wycliffe, Chief of Operation, International Solar Alliance, to give the opening remarks and set the context for the session. Over to Mr. Joshua. Thank you.
Good morning and Sabal here. It's a great pleasure to be here and welcome you all today, both people who are here physically as well as those who have joined us online. Ladies and gentlemen, this is a very important aspect of solar sector, solar energy in the health sector. And I recently read an article and it was so motivating to see how the International Solar Alliance has aligned itself to a strong message that no woman should give birth in the dark, no surgery should be carried out in candlelight, and no child should be left vulnerable to disease because of not being able to have vaccination stored. For too long, a lack of reliable power and time. We've had to live with this in remote rural communities around the world. And International Solar Alliance and a group of friends and relationships that we have brought together are looking at how we provide access to healthcare in the area of healthcare using solar power and solar energy, and provide access to the many, many millions that are around the world. Given that as many as 733 million people around the world still lack access to electricity, even today, there's a huge potential for growth, which would require substantial financial assistance and investments and resources and instruments to accelerate the deployment of solar solutions for ensuring energy access to all. Health has a central place in SDG 3, which ensures healthy lives and promoting well-being for all ages, and underpinned by 13 targets that cover a wide spectrum of the World Health Organization's work. Ladies and gentlemen, almost all of the other 16 goals are directly related to health or will contribute to health in some way or the other. Despite this, health clinics, maternity wards, surgical blocks, medical warehouses, and laboratories rely on only intermittent and unstable electricity to cool drugs, power lights, sterilize equipment, and run life-saving medical technologies, endangering lives and putting lives at risk. Ladies and gentlemen, reliable power is required for a quality health care. Maintaining the cold chain for vaccinations and medications, for example, is becoming all the more critical. This poses a serious problem to stakeholders such as policymakers, engineers, innovators, and energy companies. Relying on carbon-free green energy alternatives could become a sustainable solution for consumers and the environment as a whole. I was going to use an exemplar of the energy sector in Mauritius with a total installed capacity of around 856 megawatts in 2021. The electricity generation in the country is dominated by fossil fuels, followed by bioenergy, solar, and of course other renewable energies. The CEB currently produces 48% of the country's total power requirement from 4 thermal power stations and 10 hydroelectric plants. The remaining 52% is purchased and from independent power producers, mainly private generators from the sugarcane industry, and of course bagasse and imported coal. In 2020's budget speech, the finance minister of Mauritius announced the setup of 2 megawatts floating solar PV plant at Tamarind Falls Reservoir, increasing the capacity of the solar PV farm at Henrietta from 2 megawatts to 10 megawatts, installing 1,000 solar panels on homes of low-income families and commissioning a battery energy storage system of 14 megawatts. To encourage use of renewable energy, it was also stated that a medium-scale distributed generation scheme with a maximum capacity of 10 megawatts be implemented, allowing beneficiaries to generate electricity from their own consumption and sell excess to CEB. Rooftop solar capacity of up to 25 megawatts for residential and public buildings will also be made available. To achieve the renewable energy targets by 2030, Mauritius plans to develop 180.3 megawatts of solar power using solar projects and within the utility scale of the solar projects that they will be developing. Mauritius has a well-developed health system. The public health care is free for its citizenry. About 73% of the health needs of the population are catered to by the public healthcare systems institutions and 27% by the private sector. Non-communicable diseases such as cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases account to about 80% of the total mortality in Mauritius every year. Healthcare is one of the main priorities of the government of Mauritius, and the country looks to improve its healthcare systems by further addressing non-communicable diseases. Mauritius's healthcare infrastructure includes 5 major building hospitals, 6 specialized public hospitals, 18 multi-specialty clinics, 11 private specialized clinics, and 28 medical laboratories. International Solar Alliance's engagement in Mauritius includes the country being recognized, the challenges faced in the energy access, and space to mitigate the energy access issues through a cheaper solution approach. The country has submitted the EOI to develop a pipeline of projects with the partnership of the International Solar Alliance programs, which would help them scale solar appliance and applications for agricultural use, and of course, the implementation rollout of solar parks. The country is also linked its grant agreement with ISA to solarize the Jawaharlal Nehru Hospital in Rosebel under the ISA's initiative to provide solar project as per the country's priority. So with all these being proposed, ISA has worked with countries around the world, especially within the Latin America, and also in the surrounding region, including that of Guyana. Recently, ISA, earlier this year, launched a healthcare facility with a solar-powered energy into the hospital healthcare systems, providing the buildings with primary and secondary support systems for its solar sector, harnessing the abundantly available solar energy within the country. The purpose of today's event is to explore how solar power can assist and help build resilient healthcare systems and infrastructure like that of the exemplars that I've mentioned in Guyana and other countries. I'm sure that our discussion today will allow us to formulate a clear roadmap for solarizing the healthcare sector around the world. Having said that, let us hope for a fruitful discussion. Thank you.
Thank you, Mr. Joshua. Now I'll make a presentation on ISA healthcare facilities. Rajinder? Can you share the screen? Rajinder? Okay, thank you. So today I'll make a presentation on ISA's care initiative, under which ISA is supporting member countries for solarizing the health facilities in the countries. Next, please. So in ISA's vision, every home, no matter how far away, will have a light at home. With this vision, we are, I cannot see. We are on a mission to solarize the world by 2030 by enabling energy transition of 1,000 gigawatt of solar capacity, reducing carbon emissions by 1,000 million tons, ensuring energy access for 1,000 million people using clean energy solutions, and mobilizing 1,000 billion US dollars of investments in the solar energy sector, and establishing solar as shared solution for climate, energy, and economic priorities across geographies by ensuring global energy transition, national energy security, and local energy access. By this, ISA is committed to facilitating SDGs 7 and 13. As a theory of change of ISA, next please. Next please. Yes, theory of change of ISA, it's a strategic framework for global solarization. The three issues have been identified. These are energy access, energy security, and energy transition. And the priority areas to address these issues are analytics and advocacy, capacity building, and programmatic support, particularly for LDCs and small island states, member countries. And the key activities for these priority areas are readiness and enabling activities, risk mitigation and innovative financing instruments, investment mobilization, and promotion of technologies. The outcomes of these activities will be reduced cost of solar technology, its application, services, and finance, skilled workforce, solarization of energy ecosystems and economies, market creation and enrichment of market ecosystem, supported mobilization of $1 trillion of investment by 2030. For enabling activities, is preparation of feasibility studies for innovating financing instrument, risk mitigation instruments are being developed, and for invest mobilization, we are facilitating private sector to make investment in the solar energy sector. And through that, we are promoting different technologies by having demonstration projects. Next, please. So ISA has made significant strides with speed, agility, and efficiency. In 2019, the tendering for aggregation of 272,000 solar pumps were done, and by having bidding for that, it was the global price reduction of 50% in the solar pumps were observed. So this is the model. By aggregating demand, we can reduce the cost of technologies. And up to now, 9.5 gigawatt of proposals have been received from 41 countries under different ISA programs. Under the capacity building program, as an ISA has trained technicians, engineers, bankers, and up to now 2,608 master trainers and professionals and bankers and technicians have been trained by ISA, either by online training program during this COVID period, and in person also by inviting them to different technology institute like National Institute of Solar Energy, India, and other such supporting institutions. For the programmatic support, ISA has been supporting LDC and small island states. Under these programs, up to now, we are supporting 27 demonstration projects in the pipeline or have been implemented, like the one we will be discussing today for Guyana. And the global ISA has been participating in the global platform like World Economic Forum, Davos, and UNFCCC Conference of Parties every year. ISA is also acting as thought leadership, providing thought leadership by organizing World Solar Technology Summit in Peru and Sun World 2019 in Peru. ISA Secretariat is also producing analytic reports for the member countries. Ease of doing solar report 2021 has already been launched, and 20 ease of doing 2022 is also available for the countries to assess their readiness for implementing solar projects. Another analytic reports like Global Solar Investment, Technology and Market reports have also been released this year. Up to now, 110 UN member countries have joined the ISA framework, has signed the ISA framework and has joined the alliance. So as today's session is on Guyana, so I'll explain how under the programmatic support section, ISA is supporting different countries. For programmatic support, particularly for the LDCs and small islands member countries, ISA is running 9 programs. One of first program is scaling solar applications for agricultural use. Under this program, all off-grid applications are promoted, like solar water pumping system, like solar home system, solar street lighting, and any other off-grid applications is promoted under the program 1 of ISA. Affordable financing at scale, program number 2. This is cross-cutting program to provide financial support to all the programs of ISA. This program is used. And scaling solar mini grids for far-flung areas and remote areas, facilitating deployment of mini grids is supported by ISA by preparation of DPRs or feasibility studies and to prepare bankable projects for financing. Program 4 is scaling solar rooftop. Under this program, grid-connected rooftop solar power plants are promoted. Although it's not limited to grid-connected, other off-grid applications, solar rooftop applications are also promoted. And another program is scaling solar e-mobility and storage. Under this program, we provide facilitate deployment of scaling of e-mobility and storage by solar. Program 6 is solar parks. It's ground-mounted utility scale power plants are promoted under this program. And solarizing heating and cooling systems, solar cooling and heating applications by solar using solar energy is promoted under this program. Solar PV battery and waste management and solar green hydrogen program. These are newly launched program, and ISA Secretariat is working to facilitate this program in the member countries. Next, please. So the key focus areas under programmatic support to ISA member countries is policy and regulatory support, technical assistance, developing bankable projects, capacity building, knowledge dissemination, and country outreach, as I have explained earlier, like sharing of reports, carrying out missions to the countries for preparation of the projects, capacity building, the training for technician, engineers, master trainers, MTech fellowship program, and bankable projects, preparation of DPRs and feasibility reports, and technical assistance to prepare these reports to the member countries. Next, please. Under ISA cares, next please. In the promotion, solarizing healthcare facilities was promoted. The first project that has been completed under this program is Solarizing Orella Healthcare Facility in Guyana. It was 9 kilowatt solar power plant and 40.9 kilowatt hour of battery was used, and it's a hybrid system which was promoted. ISA Care theme. This project was done under this ISA Care's initiative of so to solarize one primary health care center in each district of the member country is our target, and it will focus on building robust energy infrastructure and finding out solar solution to make resilient and sustainable for the health sector. The expected outcome of this initiative is continuous provision of lighting, communication, refrigeration, and sterilization in the remote areas, extended diagnostic services. These are very critical. Health worker retention and attendance. A lot of studies have proven this, that after reliable electricity supply to the solar health care centers in the remote areas, attendance of the health worker also increases. And it also results in increased operational hours and improved hygiene and environmental health conditions. Another projects which are under implementation or have been implemented are for Benin. Here, 15 kilowatt solar PV plants will be installed. The tendering for the system is done by the country. One thing I'll emphasize, ISA Secretariat gives options to countries for implementation of these projects. If a country asks for implementation on their own, that is also allowed. If they want to prepare the DPR on their own, a support of $5,000 is given. If the country wants ISA Secretariat to prepare the DPR, for that also the PMC, which Project Management Consultancy, which has been shortlisted by ISA Secretariat, NTPC Limited, they help us, the member countries, in preparation of DPRs. After preparation of DPRs, this is approved by a committee of ISA Secretariat. After the approval, implementation also started. Under implementation, again, there are two options. Either country can choose to implement on their own if they have the capacity to do that. Otherwise, if the country asks ISA to implement, again, the PMC of ISA does the tendering and other processes and implementation of the project on the ground. So these different options are available for the country. And the total limit of this up to last year was $50,000 of grant. It is grant only, so that the member country develops the capacity to know how to prepare the DPRs and then how to implement the project on the ground in the remote areas. And different supports are provided by the ISA Secretariat so that the country can scale up the project. Another country is Burkina Faso. Here, under this program, solarization of 2 health facilities have been identified. At one place, it is 3.5 kilowatt, another is 4.5 kilowatt. Project sites are located in unelectrified areas. However, the facility has yet not been electrified. So solarization was the only solution for providing electricity to the health facilities. Comoros, solarization of 2 health facilities has been identified for this project. It was 6 kilowatt at one place and 9 kilowatt at different place. So the capacity of the solar panel, solar battery, the type of material, the standards and specification And that type of technical support is provided to the member country by ISA Secretariat. Another facility like in Fiji, 2 project sites have been identified. One at one site 8 kilowatt solar PV will be installed, at another 20 kilowatt of solar power plant with battery bank will be deployed. So these are all designed, taken into consideration to provide the affordable and reliable around the clock. Whenever we design a solar power plant for the health facilities, that care is taken care of, that 24 hours electricity is provided to the facilities. Primary health center, their requirement is very less, so 3 to 5 kilowatt systems are provided. And in the community health centers, normally it's varies from 5 to 10 kilowatt. And for hospitals, the experience is that they ask for the main load to be for 24 hours on the operation theater. So all these calculation of solar panels or the size of the battery are done beforehand to prepare the DPRs. The Guyana, already we will be having that video also after my presentation. You will see how beneficial it was for Guyana. Like Guyana, they face several challenges. First, they opted for preparation of DPR for that remote location. The DPR was prepared by ISA Secretariat with the help of its PMC and TPC Limited. And after that, the country has chosen to implement the project on its own. So that freedom was given to the country. They implemented it. During implementation, they faced this challenge of supply chain. There was some problem due to COVID-19 situation. And all the material was received except the battery. So it delayed the completion of the project, commissioning of the project. So such challenges also they learn how to overcome these challenges. The purpose of providing this demonstration project is not providing one-time grant, because one-time grant cannot sustain the project. By providing this grant for demonstration projects, there are learnings for the country to involve private sector. Rather, ISA Secretariat push for that country should implement on their own instead of asking ISA Secretariat, although it may be difficult for them, but they learn several lessons, and they that way they support the local the local supplier also to develop their capacity for implementation of such projects. Another country is Mali, where a grant of $50,000 have been sanctioned. The Mali is going ahead with the implementation of the project on their own. Okay. Okay. So Mauritius, we are having a session today in the afternoon. We will discuss the details of Mauritius project in the afternoon. Niger has chosen to implement the project on its own. 18 kilowatt power plant will be installed in the Gave hospital. It is a main hospital, and they have selected a particular area, operation theater, for providing round-the-clock reliable electricity by solarization. And Uganda, here we will be facilitating health facilities of 3 kilowatt in the remote areas. So that was all for the ISIS Secretary. Thank you. Thank you very much. Now I will request Dr. Karan from Gavi to make the presentation before we play the video for Guyana. Dr. Karan, over to you. Thank you.
Thank you. Thank you so much. And thank you for having me here. And it's a pleasure to interact with all of you and inform you of what Gavi is, and also how we are working towards solarization of health facilities using a platform that Gavi has been working on since 2017. Please let me know if you can see my screen. Somebody, yeah, I hope you can see my screen.
Yes, sir, it is visible.
Perfect. So, I will be primarily be speaking about how Gavi has been leveraging the cold chain equipment optimization platform. But before I do that, I'll just for the audience say something about Gavi, the alliance, the supply, a bit on supply chain strategy and how we are using our cold chain equipment optimization platform for solarization, and moving ahead, what are the plans for this platform for wider solarization of health facilities. So as some of you may already know, Gavi was created to redress the serious inequity problem in terms of access to vaccines. So in 2000, when Gavi was established, there were wide inequities in terms of the availability of life-saving vaccines to countries between the rich and the poor countries. And the high-income countries had introduced, 73% of the high-income countries had actually introduced the HIV vaccine way back in 2000. And at that time, only 3% of the
Dr. Karan, may I interrupt you? Your slide is not moving. Can you please check? And
yeah, sir, can you make it in power presentation mode?
yes, please.
PPT mode, please.
Make it in the PPT mode.
Yeah.
It is from, okay, I can see it. It's in PPT mode from my end.
But
not
it's
sure. Can you see it moving now?
No, it's the same.
Let me stop and share again, please. Sorry about that. Technology challenges.
Yes, please share again.
Yeah.
Can you see it now?
Yeah, it is moving now, I think. Sir, make it on the first slide. Yeah. And now the second, sir. Yeah, we can see. We can see one by one, sir. Yes,
can you see the third slide?
Yeah. We can see the third also.
Maybe if I'm moving to the full screen mode, maybe there is a problem which is happening. I don't know.
Okay, sir. You can do it like this only, one by one.
Is it visible?
Yeah, it is visible. The third one now.
All right. So in terms of, as I was saying, Gavi was really created to create an equal access to vaccines. In 2000, 73% of the countries had HIV vaccines, which are high-income countries. However, only 3% of the low-income countries had this. So now, if you see, by 2014, 100% of the low-income countries being supported by Gavi have now introduced this HIV vaccines, as compared to, of course, the 100% for high income. So we are at par with them. Similarly, Gavi is also helping introduce other vaccines which have lagged behind in a number of our low and middle income countries. It's not only the introduction of the vaccines, but also the support that we provide for implementation, so that the coverages of these vaccines are also pretty high. So in terms of the example that the HIV vaccines, in fact, now if we see the coverage of HIV vaccine, which is included in the Penta, which is the 5-in-1 vaccine, the coverage in low-income countries is 78% versus 70% in high-income countries. And for the pneumococcal vaccine, it is 51% versus 48% in the high-income countries. So that ways, Gavi's really come in and help support the low and middle-income countries to introduce, not only introduce, but also scale the vaccines. Now, Gavi is a public-private partnership that helps vaccinate about half of the world's children against these vaccine-preventable diseases. And the alliance brings together developing countries, donor governments, WHO, UNICEF, World Bank, the vaccine industry, technical agencies, civil society, and other donors, foundation, and other private sector players. Our vision is to, for the current strategic period, which is running from 2021 to 2025, is to leave no one behind with without vaccines, life-saving vaccines. And our 5.0 mission is primarily to save lives and protect people's health by increasing equitable and sustainable use of vaccines. When we started in 2000, we have 73 low-income countries were being supported. And as per the model of Gavi, where we transition out countries when they have once they have achieved a certain level of GNI, in 2021, we have now 57 countries which are being supported. In addition to that, over the last 2.5 years, Gavi is also working with a number of partners through the COVAX support, and we are supporting 146 economies and 92 lower income economies to provide the COVID vaccine at scale. Now, coming to our, so all of this cannot really be done without a robust supply chain. And Gavi provides support not only for the vaccines in terms of the vaccines being provided, which are co-financed by the countries themselves, depending on their GNI, but we also provide them support, grant support for health system strengthening, for technical assistance. And using the different levers, the countries are able to then provide these vaccinations to the communities and the last mile geographies. All of this cannot be done without a robust supply chain, and we have a supply chain strategy, and I'll be speaking a bit about this in terms of the fundamental infrastructure that we are providing and supporting. The aim of the support through the supply chain is to ensure that strong supply chains enable the delivery of life-saving vaccines to every person when needed, no matter where they are. And we do this by having 6 investment priority areas, ranging from data visibility and use, strategic planning, system optimization and segmentation, capacity development, fundamental infrastructure, and system integration and harmonization. And by doing this, we want to achieve access to the vaccines, which is through extended reach, vaccine availability, improving the efficiency of the systems to deliver these vaccines at lower cost and lower wastages, and ensuring that these systems are resilient, are responsive, and both programmatically and financially sustainable. In terms of coming to the cold chain equipment optimization platform, this platform was established in 2015-2016 and came to fruition in 2017 when we started supporting countries. This was established with 3 primary objectives. One, of course, to help ensure that functional cold chain equipment is available where it is needed to support coverage and equity goals and protect vaccines. So not only to help countries introduce new climate-friendly technologies, but which are better suited to their needs, so that you can have an accelerated uptake, but also because of the market shaping ability of Gavi, which we had demonstrated in the vaccines program, where by pooling demand, we were able to reduce the cost of a number of these vaccines. The same principle was applied to the cold chain equipment, where we helped to shape the market to accelerate not only innovations, improve the supply by bringing in more manufacturers into sphere, and also to reduce price. So this platform really was established with these 3 objectives. How does this platform really work? So CCOP platform aims to scale up uptake of efficient and sustainable cold chain technologies at affordable prices. And this is a joint investment between Gavi and countries, where Gavi provides grants to the tune of 80% or 50%, depending on the country's categorization in terms of their GNI. And what we do is, by pooling the demand from the countries, we are able to have the eligible countries are able to apply for funding based on their needs, and Gavi pools the demands from all the countries. And this pooled demand is met through UNICEF, where UNICEF, acting on behalf of the alliance, negotiates prices with the manufacturers and we are able, not only the prices, but also the deployment of these equipments. The important aspect here that I want to bring to the attention is that we have supported countries to deploy cold chain equipment in the past also. But what was the change under CCOP is important to know. Previously, when the countries were supplied the cold chain equipment was supposed to be installed by the countries themselves. However, we saw a large number of countries were struggling with it. So the change in this was that the manufacturers were now tasked to not only provide the equipment, but also as part of the service bundle, install the equipment and provide training to the end users on the preventive maintenance of these equipments, and were also bundled with warranty, which is a minimum of 2 years warranty and ranging from 2 to 10 years in different manufacturers. The operations and the maintenance of these equipments was handed over to the countries. Where we are with this platform right now. So Gavi's cold chain equipment platform is a major, we have been a major investor in solar cold chain equipment through this platform. About $197 million has been invested, and we have procured over close to 42,000 equipments which are there in these health facilities, which are mostly our remote health facilities providing immunization services. So we are almost deploying 22 solar fridges per day. However, what we see now is that this really provides a unique opportunity to establish a systematic and scaled health facility solarization and saving lives. And by partnering with other donors and development partners and other players in the energy sector, Gavi can harness its investment and processes to electrify 10,000 facilities per year, which we have been doing for the past 4 years through the CCOP platform. So there we see a big opportunity here. And why? And this is very much aligned to the primary healthcare goals and also the UHC agenda. And it can have a great impact on primary healthcare as well as the immunization goals, be it in terms of making the vaccines available through the primary healthcare for more reliable and higher quality services, by extending the facility hours or reliable power to CC or to equity, where we are able to provide services to zero-dose communities, the communities which have not got any vaccines, or children who have not got any vaccines, the zero-dose children, and generate demand for immunization and other primary healthcare services in these hard-to-reach areas, increasing community trust and satisfaction, increased staff retention and training, as has been mentioned in the past by the previous speakers also. In sustainability, obviously, it's providing long-term sustainability for the immunization and primary healthcare programs by reducing energy cost as compared to other methods being used by these countries, including gensets, and reducing vaccine wastage and stockouts. As I mentioned earlier, was healthy markets, obviously, to bring in appropriate and high-quality equipment into this ecosystem, and increasing manufacturer and vendor base for reliability of the health facility solar electrification market and driving the costs down. We see that through the CCOP platform, we will be able to really, hit a number of barriers which countries usually face in the HFSC, be it in terms of high capex costs, which are unaffordable for many of the LMC countries, or limited coordination and planning processes leading to fractured efforts and poor asset management, or inefficiencies in negotiating and managing equipment procurement and service agreements. All of these things have really been dealt in by the CCOP platform, where we have pooled funding and procurement, which can help CCOP financing contributing to the full electrification of the services. We have deployed program management units, PMUs, at the country level, which can help in terms of the operational planning. And I mentioned about the service bundle, where we are ensuring rapid and high quality deployment of these solar assets to facilities, even in the hard to reach areas. We are now embarking on a multi-year pilot program to see whether we can leverage the CCOP platform for wider solarization of health facilities, and not limiting ourselves to just solarizing or just equipping the facility with a fridge. So this really is going to help us answer a few questions in terms of operational planning, in terms of health impact and multi-sectoral collaboration coordination. And if this is successful, then it will help us to have a strategy around solarization of health facilities, which goes beyond equipping the health facilities with cold chain equipment. It's a multi-year program. We are right now in terms of the preparatory phase where we are looking to securing country commitments, and we've developed a business case and going to go for resource mobilization. And thereafter, we'll start working with 3 to 4 countries in terms of planning, application and planning and implementation of the program. With that, I'll end my presentation here, but happy to answer any questions that you may have. Thank you so much.
Thank you, Dr. Karan, for your very nice presentation. Now, I would like that the video for Guyana's project may be played, as national focal point of Guyana could not join us due to some logistic issues. So he has asked us to play the video that will capture the aspects of solarization of health centers in Guyana. Thank you.
Guyana, located on the northern coast of South America, is a diverse country with a growing economy, pristine forests, and other natural resources. Guyana depends on imported fossil fuels for its energy needs, resulting in high fuel prices and electricity rates. High energy costs impact households and operating costs for businesses, and poses even more of a challenge for hinterland communities, dampening efforts for electrification and energy access. However, the sun has come to the rescue, improving access to electricity in hinterland areas through solar photovoltaic systems. The use of this solar PV technology forms part of Guyana's recently updated low-carbon development strategy. The strategy focuses on investing in clean energy for future growth through an affordable, stable, and reliable energy system for Guyanese and by extension the world. This is being achieved by advancing a sustainable energy transition through an energy mix of hydropower, natural gas, solar, and wind. Funded by the government and key international partners, these projects lead to more than 500 megawatts of new power. One such project, funded by a US $50,000 grant from the International Solar Alliance, was the installation of a solar PV system in Oriella.
This is a 9 kilowatt facility with a 37 kilowatt BESS system allocated to that station. This is a scaled initiative that can expand throughout Guyana in terms of other far-flung communities that need energy.
Oriella is a small developing indigenous community approximately 40 miles from Crabroot Creek, Quarantine, Berbice. The village is mainly accessed by river.
In 1925, Oriella started, the village itself, just with a handful of people. It's a place made up of Arawak and Warao, originally. And then we had a few like Caribs. And then like 10 years ago, then we started intermarriages. It never used to be like that before. We have like 1,200 people in population. That's Oriella by itself. We have a school with like 400 plus pupils. We have 9 teachers. And we have the health center with the doctor.
The entire village is powered by a small diesel generator.
Well, the diesel is quite expensive and we got to send out with boat and things like that, so it's kind of rough.
Rationing electricity at the 24/7 Oriella Health Center, which also serves the small indigenous village of Siparuta, affected patient care.
In the nights also, because of the small solar system that we had before, we would have to sterilize instruments, and we would have to do that in the day because the energy supplied by the old solar system was not enough to power the autoclave. But the autoclave is basically a sterilizing machine. We use it to sterilize instruments. And if I'm to have back-to-back patients that need instrumentation, I would need to resort to aseptic or antiseptic solutions to sterilize those instruments in the night. Also, the ultrasound machine, now with the solar system that we had before, the current used to fluctuate. So because those machines are expensive, we would need the village current to be put on.
In cases of emergency, flashlights or even phone lights were used to tend to patients.
Because in the night coming here, most of the times we work with torchlights.
Now, with the new solar system, patient care and staff comfort are much improved. And because of the amount of power being generated, there are big plans to do more.
The resource of having light would actually help what we're trying to do, which is giving the best patient care possible.
Guyana, located on the northern coast of South America, is a diverse country with a growing economy, pristine forests, and other.
Thank you. Thank you very much. So now we have that panel discussions. First, I'll ask on the panel are Dr. Karan from Gavi, Mr. Vikas Gaba from KPMG, and Ms. Laura from AppTech Uganda. So my first question to Dr. Karan, can you hear me clearly? Dr. Karan and Mr. Gaba?
Yes.
Okay,
Yes,
thank
I can. Thank you.
So my first question to Gavi is what are the key challenges and gaps in various categories of healthcare facilities and how solar can contribute in strengthening the healthcare segment? Mr. Gaba, Dr. Karan.
Thank you so much. I think a number of those were actually highlighted in your presentation and aspects which Guyana also spoke about. However, as we see, poor electricity access really affects most aspects of primary healthcare delivery. While the degree of impact may vary, it is particularly devastating with the medicines which require temperature control like vaccines, and maybe around timely diagnosis of variety of infectious diseases in case of diagnostic equipments, and sustaining life in the case of oxygen delivery devices and pulse oximeter. And these equipments are being used at a number of health facilities, right from the national big hospitals to the primary healthcare facilities in the last mile. As we see, women and children are often disproportionately affected by electrical challenges, as complications in pregnancy and childbirth often require advanced care and with more than one electromedical devices. And if those devices are not being provided with the constant source of energy, then they are not going to be used in these facilities, and hence can really impact the care that is provided to women and children. Through our platform also, the CCOP platform that I just spoke about, we have inventory data from about 30 countries, which reveals that about 50% of births are served by facilities with unstable electricity. And when we say unstable electricity, we mean less than 8 hours per day or no electricity at all. And this again places all the services being provided by these facilities, especially for women and children, at risk if complications occur that require use of equipment and there is no backup power source in place. In addition to that, you can always, there are other aspects which are hindered. For example, the lack of connectivity will inhibit the use of digital solutions and critical data collection. So for example, the health management information system or the electronic logistics management information systems which are in place or could be in place are not being used primarily because the facilities do not have reliable energies and services. And this really leads to lack of credible data, which should be used for planning purposes, monitoring and planning for the essential goods and services. In addition to this, the issue around maybe security also, it prevents equitable access to care by creating both demand and supply side barriers. So there are a number of challenges which exist and can be addressed by reliable energy solutions.
Thank you. So my next question is to Mr. Gaba from KPMG. Mr. Gaba, what are the latest technological trends and government initiatives prevailing in solarization of healthcare facilities and its usage and operation and maintenance procedures?
Yeah, sure. So thank you for having me at the panel and very good morning to all. So let me respond the second part first. I think first that solarization of health center has immense potential to improve service delivery and health outcomes is known. And we have seen that examples from the presentation you made and also the change that we saw at Orilla. Now, there are numerous cases of solarization of facilities, whether it is solar plus battery usage, vaccine cold storage chains, mobile health diagnostic clinics, telemedicine, back-end IT infrastructure that can do a lot around data. And benefits are proven and validated. There are many case studies that are there. And with falling PV prices, I think solar has become very economical and sustainable alternative for conventional electricity. Now, I think what is required for countries where demand is, say, small, vis-a-vis the global demand and what we are seeing the large deployments, I think the key will be how to join up the aggregation efforts by global agencies so that one, capital can be mobilized, second, deployment happens at scale and is of high quality, and service provision, as we heard in the Gavi example, can be bundled alongside. I think you and Mr. Joshua also spoke about ISA's initiative. I think that is very important. Governments, the entities acting as anchors to bring that aggregation, to create that facilitation provides a lot of comfort, and success can be built around that. And many players and stakeholders can be roped in around that. And MDVs like ADB, etc., all of them are supporting, and there is a whole lot of support around that. Now, coming to on technology, I think one at the base is deploying the DRE systems, which is an integrated solar and battery system that presents an alternative to the current electricity supply, whether it is diesel or the grid power, unreliable grid power, as the case may be. And this DRE solutions can provide an array of services around them, and including around medical emergencies such as solar-based cold storage, vaccine refrigerator, baby warmer, portable healthcare kits, instrument sterilization, extended working hours for health facilities, and so on. Now, when used in combination, this is the basic solar plus storage, of course, is a basic at the basic level, but it can be used for extended hours once right kind of optimization systems to manage the load are built in around that. Some examples of new technologies are remote monitoring systems, which help in optimizing the battery and the entire system performance, tracking that very closely. If some health centers that have become large, health security management, logistics management of inflow and outflow of the vaccines and patients can be deployed in conjunction. Second is bundling of not only solar, but also the energy efficient equipments. And there are examples where LEDs, energy efficient fans, energy efficient freezers have been bundled along with these deployments so that it makes the basic functional health center fully operational with not only the supply side greening and efficiency, but also bringing in the consumption efficiency around that side. So that is a second example. Third is solar powered medical equipments itself, like oxygen supply system, solar powered oxygen supply systems, blood pressure monitors, etc. And there are examples in Africa where this has been deployed, especially when when there are villages which are unelectrified. But the use cases of this have also been seen in Bhutan, where the cost of delivery of such services because of the hilly terrain is very high. And in, say, Maldives, where the expanse of the island is very long and the cost of delivery again becomes high. And the last I would say is more on solar powered mobility, where initiatives like solar powered boat clinics that have been used in India, where 5 kilowatt solar panels have been installed and they are deployed around the river channels to provide mobile health services to a community around that. In Bangladesh also, there are examples where solar powered ambulance has been providing services day and night as using along with battery systems to different customers. So I think in summary, I would say that technology solutions exists. A lot of innovations are possible to suit the context of that specific country and the use case that is being considered. And initiatives through aggregation, through an anchor nodal agency, the right financing structure needs to be thought out to deliver such solutions at scale, where multiple countries can be considered as a bundling of multiple countries can happen. Mr. Sharma, back to
you. Thank you, Mr. Gaba. Very well said. Now I will request Laura a question. What are the various business models to promote solarization of healthcare system? Since Laura has been working for the private sector, she knows what is there suitable for the on the ground. Yes, thank you.
Thank you so much, and thank you for having me here today to speak. So I'm the Chief Business Development Officer at Aptake Africa. It's an engineering, procurement, and construction company that operates across 7 countries in Africa. But I wear 2 hats. Actually, my background is in medicine. I have a master's degree in nursing. So I've had the experience of working in health centers in the States as well as within Uganda. So I bring a very different lens to the renewable energy sector. I've been living in Uganda for the past 14 years, but I've been in the renewable energy sector for 6. So Aptake Africa, we're headquartered in Uganda, but we work in frontier markets. So we also have offices in South Sudan, Central African Republic, Sierra Leone, Niger, and we operate in DRC and Liberia. So we're operating in some of the more difficult places in Africa. I think you guys probably know about that. We've done a lot of installations for solar systems, but what we found is that when we go to these health centers, sometimes there are solar systems that are already there. They're already on the roof. They're there, but they're in disrepair and they're not being used. So what that tells us is that there's not an operation and maintenance budget in place by these health centers, okay? Solar is a great solution, it works. But a lot of times I hear marketers in our sector telling people that solar is maintenance free. That's not true. Solar is not maintenance free. You have to at least clean the panels. If you don't, we live in these dusty African countries. The efficiency of the panels goes down. You have to check your inverters at least biannually, your cabling, your mounting stands. There's maintenance that has to be done. And there has to be spare parts there in case you need to change anything. And batteries don't last forever. They need to be replaced. So solar is not maintenance free. Health centers have to understand that. And when we go and we build these solar systems from them, there has to be a long-term plan in place to operate and maintain these systems. But the good news is what we've seen. Once we do install these solar systems, everyone within the community, the number of customers or clients or patients increase at these health centers, which is in turn increasing their revenue. Okay, so it works, right? These health centers are getting more money, but it's an issue of taking some of that revenue and setting it aside for the O&M. That's not happening. So it's possible, it's just not happening. So when we talk about business models, there's a couple things we can look at. We can talk about anchor load, right? So if we have a health center that's within a community and they have a lot of roof space, sometimes we can create more energy than the health center itself needs. In cases like that, the excess power can be sold to the community, they can collect a tariff, and that revenue can be used to cover the O&M expenses. The flip side of that is a lot of times we'll have businesses in these communities cover their roofs in solar, they generate more energy than they need. They can either sell the energy to the health centers pay a tariff, or if they're a particularly generous business, it can be their CSR to just donate the energy to support the community and to support the health centers. So we can look at solutions like that with anchor loads and off-takers. If we look at developed countries, a lot of times they'll have these feed-in tariffs. The countries where I work in, Uganda is just now for the first time piloting a feed-in tariff model. It's never happened. South Sudan, not there. Central African Republic, not there. Sierra Leone, not there. So it's not available in a lot of these African countries, but in more developed nations, they do have that ability to get a revenue from a feed-in tariff and use that for the O&M. Aptech Africa, we actually had a really great innovative business model that we pitched and were awarded funding through Power Africa, because this is an issue that has come across, everybody in Sierra Leone with their health centers. But you can take a health center, put solar on the roof, put energy storage, and then take an extra step with enough capacity to run a solar water pump. Okay, with a solar water pump, we can put in a purification system. We can provide clean water to the health facility, but then we can also provide clean water to the community. The technology is out there. They're like ATM water kiosks, basically. Grundfos has the solution. Lawrence has the solution. But if you're providing water within the community, people can pay money for drinking water. They're already doing it. A lot of people pay money for water, period, but they'll definitely pay money for drinking water that's been purified. So that's a source of revenue that can be collected. Other health centers have looked at doing like micro enterprises. So for people who understand what Africa is like, for African villages where there's no electricity, sometimes one of your main goals of the day is to figure out how to get your cell phone charged. And there will be one, we call them dukas, but one shop where everybody will go and take their phones and they plug it in and they charge them there and they pay a small amount to get their phone charged. That's how people charge their phones. If you can take that enterprise and move it to a health center that has solar, the health center can be collecting a small revenue from that, and that can also go to their operation and maintenance. So models like that are happening, they are going on. So basically, the solutions are there, we can come up with them. I just want to say one more point on the electrification of solar health centers, because this is really important to me. We talk about putting in the solar, but if our end goal is the outcome of improved maternal and child health, we also need to think about what are they going to be using that solar for. So we have Gavi, we definitely need vaccine, cold chain preservation. KPMG mentioned it. We have to look at like oxygen concentration. We have to look at incubators. We have to look at sterilization. We have to look at electrocardiographs. Okay, all of these, all this machinery, all of these tools that actually lead to the increased or to the better health outcomes that we're going for. That being said, there's a capacity building piece in that. So if we're bringing in the solar, of course, we need to train everyone on how the solar system works, how to maintain it. But we also need to make sure that we're bringing in the equipment that will bring the improved health services, and also make sure that staff is trained on how to use that. Without that, we are not going to see the improved health outcomes that we are looking for. But the good news is that there are so many innovative business models, and it's possible and we can do it. Thank you.
Thank you, Laura, for bringing these points to all. It's very, very important. What even in ISA we think that involvement of private sector and identification of business model for different promotion of different technologies very, very critical. So as we have seen from today's discussions, Dr. Karan has highlighted how even now there are more than 50% health centers without any reliable power, and that is very, very critical. And Mr. Gaba from KPMG, how he has highlighted that it is still economical to have to solarize the health centers. So it's a good solution as of now, because providing reliable power is very critical to provide child care, mother care, like running of even small power requirements of baby warmer or the child small operation theater for child delivery. So these are very critical, and the best thing is that Laura has shared how community has to think about this solarizing health center, using that for providing clean water to communities, and have the sustainable model of getting some revenues from the solar energy and sustain the same. Thank you very much for sharing all your thoughts for today's session, and thanks again. Thanks to the audience for listening to it. I think all our member countries will be benefited by these discussions that we had today in the ISA Pavilion in COP27. Thank you so much. Thank you very much.